What's one of the biggest expenses you face as you age? It's healthcare. A new national poll from University of Michigan finds the cost of healthcare is at the top of the list when it comes to concerns among older adults. The poll found that 56% of people over 50 say they are very concerned about the cost of medical care, and nearly as many said the same about the cost of prescription drugs, the cost of health insurance, and dental care. The director of the university's Institute for Healthcare Policy and Innovation says older adults who struggle with healthcare costs can make decisions that might save money in the short run, but negatively impact their health.
What we find is people are making trade-offs between the costs of their medicines or their medical appointments and their food or housing or transportation. We also find that sometimes people cut back on the services that they need in their health care. They may take their medicines less frequently, not fill their prescriptions for high blood pressure or diabetes. They may hold back on seeing the doctor when they have a new symptom that's concerning, and their doctor either might be able to help them identify the problem or reassure them that it's not serious.
And the concerns were similar across all older residents in the poll, regardless of gender, race, or where somebody lived. Those surveyed were also worried about something else: the cost of home care, assisted living, or long-term care. Now, outside of health care, another top concern was scam and fraud attempts, in which older adults are increasingly targeted.
When older adults or adults of any age are faced with a financial scam or fraud attempt, it has a substantial effect on their mental health. It can trigger anxiety, depression, a wariness of interacting with others, a loss of confidence if someone is affected by a scam. So these are some of the ways that financial concerns play into mental health and sometimes even physical health.
Well, the hope is that these opinions might help shape healthcare and push lawmakers to keep the cost down.